Orthodontics is the field of science that deals with the alignment of teeth and jaws, as well as with tooth movement. The position of our teeth within the jaw depends on many factors. These include the size of the jaw, the strength and shape of the periodontal musculature, and the teeth themselves. Thus, for example, the lower teeth in patients with a large tongue are positioned further out, and a crossbite can be the result. In patients with strong masticatory muscles and a wide jaw, a so-called edge-to-edge bite may result. In individuals who lost their baby teeth early due to caries, jaw growth may be slowed down, resulting in crowding of the adult teeth later in life. Optimal teeth development will hopefully achieve two things. Firstly, of course, an attractive aesthetic look. And secondly, damage to the teeth and the masticatory apparatus should be prevented. The extent to which a malocclusion can potentially cause damage to the teeth needs to be determined by an orthodontist. There is a distinction between fixed braces and removable braces. Most malocclusions should be corrected within a period of 1, 2, or 3 years at most. Before treatment with braces is carried out, all groundwork should be completed. After treatment has been concluded, a retainer is sometimes used in order to prevent any possible reverse movements of the teeth.
In orthodontics, a bracket is the term used for the restraining element on permanent braces. Brackets are glued to the tooth surface by special gluing techniques, thus creating the starting point for tooth realignment with attached permanent braces. In this film, you can see the gluing procedure, which is pain-free. A metal arch is then inserted into the bracket. This metal bracket applies the force necessary to initiate tooth movement. There are different bracket variations. These are characterized by materials, metal, gold, plastic, ceramic brackets, or method of attachment, Damon lingual brackets. Lingual brackets are attached to the back of the tooth. These brackets work well for patients who place a high value on aesthetics. Insufficient dental hygiene while the bracket is glued to the tooth can lead to permanent decalcification spots on the tooth surface. For this reason, good dental hygiene is very important. The use of a dental water jet toothbrush is highly recommended. Bracket inspection refers to bracket removal after orthodontic treatment with permanent braces. Here, you see a female patient with permanent braces. There is a distinction between the wire and the brackets. The removal itself is pain-free, but the procedure can sometimes cause discomfort to the teeth. The brackets are removed from the teeth surfaces with special pliers. It is important that the bracket glue is removed entirely. This is usually done with a special grinder that removes the glue, but not the tooth enamel. Polishing is also necessary after successful bracket removal. The risks associated with bracket removal are negligible. Nevertheless, in rare cases, there can be complications that may make further measures necessary. Every additional measure can lead to additional complications that can ultimately result in the loss of a tooth. At this point, we will only discuss the specific complications associated with bracket removal. These are melting fractures, melting cracks, melting discoloration, injuries to the neighboring teeth, secondary cavities.
Fortunately, such complications have become very rare due to positive developments in medicine during the past decades. Tooth banding is a slang term used by those in the orthodontic field to refer to the placing of metal bands on the teeth, usually on the molars. Here you see a plaster model with such bands. The actual bracket is welded to the bands. At a later point in time, a wire will be incorporated into the brackets. These bands have a much greater tensile strength and can tolerate far greater forces than classic brackets, which is the only reason doctors sometimes use bands instead of classic brackets. In most cases, so-called separators are placed between teeth a week prior to banding. That way, the bands can be painlessly placed on the teeth. In the first step, the appropriate band is selected for the matching tooth by a process of trial and error. This is important so that no unnecessary gaps develop between the teeth. The appropriate metal band is filled with cement and lightly pressed onto the tooth. With special instruments and great care, the band is eventually moved to its final position, where it will stay throughout the entire treatment period. The risks related to tooth banding are usually relatively small. However, complications can develop in individual cases, and these may require additional measures. Each additional measure can in turn lead to further complications, which may even result in the loss of a tooth during the course of treatment. At this point in our discussion, we will only deal with the specific complications associated with tooth banding. These include, for example, caries, damage to neighboring teeth, or periodontal damage. Fortunately, such complications have become very rare due to positive developments in medicine during the past decades. Incognito is the name for a special type of orthodontic therapy. Incognito takes a different approach from conventional braces. Common braces are attached facing the cheeks, while Incognito is anchored facing the tongue in the oral cavity. State-of-the-art tools are used in all phases of the production of the brackets. Many people view treatment with Incognito, or the lingual technique, as unpleasant because the oral cavity is clearly cramped. Furthermore, not every malocclusion can be treated with it. In particular, crowding can pose problems. Another disadvantage is higher cost. Aligners would be an alternative to the lingual technique. Aligners are orthodontic devices that are able to correct dental malocclusions in an almost invisible manner. In aligner technology, a malocclusion can be successfully treated by the patient by wearing a series of transparent splints called aligners. These aligners are made of a thin, transparent film according to specifications of the orthodontist, who employs a special computer-aided state-of-the-art procedure, so that the teeth can be straightened without any wires or the like. The dentist takes impressions of your teeth, including the periodontium, and sends them to a company that produces aligners. The company cleans the dental impressions and digitally scans them. With the aid of the virtual model, the malocclusion is corrected on the monitor. As a general rule of thumb, the patient receives 2 new splints per jaw at each short monthly appointment. On the first day, a majority of patients experience slight pressure or sensitivity of the teeth where new aligners are placed. This demonstrates that the aligners are effective and that the teeth are moving into the desired position. Furthermore, the patient is able to remove the device and eat and drink whatever he wishes, plus care for his teeth as usual throughout the treatment course, thus employing optimal oral hygiene. The aligners themselves should at least be rinsed off with water after each application, as this prevents saliva components from settling in, which can make cleaning more difficult. Aligners are not suitable for every patient and every malocclusion. For example, canine rotations are difficult to treat.